Good morning, everyone. Welcome to our webinar of today, using your out-of-network insurance benefits. We are happy to be here with you, helping understand the different benefits that you have when you use your insurance to help you finance your therapy. And with me, well, first, let me introduce myself for those of you who don't know us. I am Dr. Claudia Salazar. I am a clinical psychologist. I am the owner and clinical director of the Center for Effective Psychological Service. We are a group practice based in Washington, D.C., and serving clients who are located in Virginia, Maryland, D.C., and Florida. With me, I have our wonderful client care coordinator. Her name is Maria Patricia Rodriguez. Maria Patricia is based in Florida. So she works virtually with us, and she does the wonderful and very important job in our practice of helping new clients get easily and smoothly onboarded with us. So she is the first person that you are in touch with when you connect with us. Maria Patricia is the one who helps clients who want to get connected to a therapist, understanding in a very general way what is it that they want to work in therapy, and to try to find the best fit for their needs and their goals and their styles with our clinical team. And she also has been helping our clients understand the financial aspects of getting services. And what we have found out in the time that we have been working together is that a lot of people don't know their full benefits when they have a health insurance plan. And so that really kind of miss on the opportunity to be able to use to their fullest those benefits that they have. So that is our purpose today for our talk. We are going to be having a very informal chat so that we can clarify any questions that you may have in the future, and that this also kind of helps as a resource for you to return to if there is anything that comes up about benefits in the future. So welcome, Maria Patricia, and thank you for being here.
I'm happy to be here, Claudia. Thank you.
So to get started, why don't we talk a little bit about exactly what is out-of-network benefits? So in your experience, Maria Patricia, when somebody calls us and they, one of the first questions that they ask is, do you take insurance? Do you take my insurance? Exactly. So how many people do you feel that they understand that they have out-of-network benefits?
Well, the truth is that not many people know about the benefits they have, especially those clients that never have therapy before. So they don't really understand that they have possibilities, even though some therapies are out of network, they don't know that they have benefits. So some insurance plans cover medical and mental health services provided by clinicians who are not assigned an agreement with the insurance company. So those providers are considered out-of-network providers, okay? But some insurance plans, like the HMOs, that do not cover those kind of providers, the out-of-network providers, sometimes they will work out with you a single case agreement, so you can work with your therapist if you lose coverage. But it's also important to understand that this agreement is temporarily and maybe not be approved. Okay.
That is absolutely true. But that is kind of like a resource that a lot of people don't know. For instance, our practice is a bilingual practice. And it's not very easy sometimes to find somebody who specializes in the kind of therapy that you need and speaks, in our case, Spanish. So that could be a good argument to go to your insurance plan and say, I would like to be able to work with this specific therapist. Would you be willing to sign a single case agreement? And in some cases, the company will accept that. And then we will, depending on the company, accept that as well. And that could be a possibility to work with us having a single case agreement. And I believe those case agreements can be renewed every 6 months. So the company will have the opportunity to say, yes, we're going to continue giving you that opportunity to work with, or not, right? But at least you have 6 months where you can possibly have an agreement with us and the company to work. We don't, particularly in our organization, don't always accept all kinds of insurance, because to be honest, some insurance companies offer a very, very low fee, and that is just not feasible for us. So we don't automatically accept all the opportunities for single case agreements, but with some companies we are able to accept that. And the other thing that I wanted to add around this out of network benefits in terms of like mental health and physical health, in terms of like history, I don't remember exactly what was the year, but it used to be the case that insurance plans wouldn't cover mental health services to the same extent that their physical or the normal medical services. But Congress introduced legislation where it's called the Mental Health Parity Act, which said if you are a company that offers medical health services, you also need to cover mental health services in the same way, in terms of like not having limitations of how many sessions we're going to be approved. You have to kind of approve basically all the at the same level of that you call the medical services. So this was also introduced, I would say probably around 10 years ago, the Mental Health Parity Act. So that was just kind of something to add a little bit to that. But thank you for the clarification about what is the out-of-network benefits. So when somebody doesn't know what their benefits are, what is the kind of processes that you normally let the client know that they can do in order for them to find information?
Yes. First of all, what I do is that I give the new client, I send them an email with some guidelines to call the insurance and to understand better their benefits. So if you have your membership, your insurance card, on the back of your card, you will see the customer service phone number. So you should call them, and they will ask you some personal information like full name, date of birth, the member ID, and the group number. So after that, you need to know and understand the code or the service code that you are going to have in therapy. So there are many codes as many services we have. So for individual therapy, those sessions that are 45 to 53 minutes long, the code is 90834. But for a diagnostic intake session, the code is 90971, because it's from 60 minutes to 90 minutes long. So there are many other codes for family therapy or group therapy, but it's good to ask your clinician which code you're gonna be using. Mm-hmm. Also, it's good to know that some services are not covered for insurance, like couple therapy or those support groups or the psychoeducational groups that are not covered. No, so the better way to understand your benefits is calling directly to your insurance and see what are those benefits. It's also good to understand if you reach out your deductible, because if you haven't reached it, you cannot afford, or you are not covered for the services. So there are many key concepts that we should understand to better understand your benefits. So some of the concepts are, for example, the diagnosis. So every provider should provide you with a diagnosis if you are planning to use your insurance. As I was telling you a few minutes ago, we should ask them if we reach out that deductible. What is a deductible? Is the amount of money you need to pay out of pocket before benefits are covered. That amount of money paid is yearly. Okay, so every week you're gonna start from zero, and then you're gonna be covered. Those services can be in network or out of network.
Yes,
Okay.
so not every week, but every year.
Sorry.
Yeah, that's fine. That's fine.
Sorry.
So that people are, oh no, every
No.
year. So for instance, now we are at the end of December, and some people are just starting with us. So hopefully, those who are using the insurance and have already made the deductible, so their sessions in December can be covered, right? But if you just started now, you may probably not gonna reach what is called your deductible. So those sessions that you pay in December are likely to be out of pocket without reimbursement, because if you haven't used your deductible for other out-of-network benefits, you probably haven't been yet reached that total amount. January 1st, your deductible starts from zero, right? And you have to kind of start accruing the money that you pay directly and out of pocket before the company starts to give you some kind of reimbursement. And some plans have deductibles for in-network. So even for you to be able to see somebody network, you have to first spend an amount of time and amount of money to be able to cover for your in-network services. And they may have in-network and out-of-network deductible. So it's very important when you call that you ask, what is my out-of-network deductible? And have I reached it, or how much I have contributed to it?
Exactly. And as you mentioned, reimbursement, some clients do not know what is the reimbursement, a concept. So the reimbursement is a percentage of money you will get back from your insurance after you have paid directly to your provider. So that means that you're gonna pay directly the provider, and then you will get a percentage back from your insurance. So in our center, I'm the one who send the claims, and like after 2 weeks, more or less 2 weeks, the client will receive a check under his name or their name with that money back. Okay, with that percentage.
Yeah. And now that you mentioned percentage, there is something very tricky when you call your insurance to ask the percentage of reimbursement that you get after the deductible, because they usually say you're gonna get, let's say, 60% reimbursement based on what's usual and customary. And that is a very tricky concept, because for some companies, usual and customary is what they think is the average or like the usual range for a therapy session to cost in a particular area. And to be honest, there are some companies that are extremely off in terms of really what's the average for our clinicians to charge. For instance, one of the companies, Aetna, here in the DC area, because Aetna has very different reimbursement rates and fees for all the states. Sometimes in the states vary. So every practice has a different contract with different fees, but they may feel that usual and customary is $70. So if they say, we will reimburse you the 60% of what's usual and customary for us, that means that they are going to reimburse the 60% of $70, which means that you are going to have to come up with the 40% of those $70 plus the whatever amount we charge. So you end up kind of having to pay a lot more than you think based on that. So it's very important that you understand what usual and customary is for the company, for the insurance company. And sometimes they don't give you that information directly. They don't tell you. So sometimes you get to find out that after the information after we have submitted claims. So, but that's something important for you to keep check in when you receive the reimbursements to make sure what is in reality the percentage of the money that you are being responsible for after you have been paying your provider.
Yeah, another concept that is key are the claims and super bills. So in order to get the reimbursement, we need to submit claims or we need to ask our providers for the super bill. So basically both are ways of invoices, like detailed statements, where you will find there like the providers, all information the providers have, the service codes, and the dates that you have the sessions. And now that we are talking about reimbursement, we believe the only way to get the claims go through is to knowing exactly what is the payer ID. That is like the identification number for a specific insurance company. So sometimes they are denied because we send, for example, a claim to Aetna with the payer ID of Blue Cross Blue Shield. So we make sure, it is better if we make sure when we call the insurance, we ask them for the payer ID. So I think it's a good idea.
Yeah. And, something that has happened a lot more now that we are able to work hybrid is that sometimes maybe the headquarters of a company, let's say, is in Seattle, Washington. So the health plan is Blue Cross of the state of Washington. But turns out that if you're located in Washington, D.C., the payer ID is local. So even though the group is from Washington state, we have to send the claim to the payer, to the local payer, which is going to be probably some branch or some subsidiary of Blue Cross in DC. So that's kind of what sometimes creates a little bit of trouble in our side, that it may be kind of like Aetna from Illinois, and turns out we have to send it to Aetna in DC for those payments to kind of be able to happen. So it would be super helpful if when you call your insurance to find out about your benefits, you can also ask for the payer ID so that we, as a practice, can submit to the right place those claims. I also have to, and I think we're going to cover that in the next slide, to talk about that not all the practitioners, not all the clinicians that you see out of network submit your claims on your behalf. Most commonly, you will see that clinicians will provide you with a super bill so that you can submit yourself. Some clients, in our case, right, they prefer to do that, or they have some kind of like weird arrangements with their insurance that they want to kind of be the ones who submit their super bills, and we do that like at the end of the month, right, Maria Patricia?
Yeah, you're right, Claudia. At the end of the month, I submit a super bill for them with all the sessions and the visits that they have, with all the information, the service code, the dates, and our providers or our practice information. Yeah. But sometimes, as a courtesy to our clients in our center, we submit electronically the claims on behalf of our clients.
Yeah, and those are claims that we can submit electronically with just the push of a button. So it's really not a whole lot of work for us to submit the claim. There is a lot of work involved in sending the claims correctly, but and resolving things with insurance sometimes is very time consuming as well, as you probably have also have the experience of trying to hold on to your insurance and trying to solve your own issues. So we help as much as we can. Sometimes it will reach the point that we need to really kick the ball and let the client resolve the issues if we are having a lot of trouble really communicating personally with the insurance to resolve some of the issues. But as much as we can, as a courtesy and to make things easier for our clients, we submit electronically. and clients usually get their reimbursements within like 2 weeks or so, whether it is a check or you have an arrangement that is going to be going into a direct deposit. That depends on what kind of arrangement you have with your HR, and health insurance reimbursement systems. We also learned recently about something that is called Reimbursify. Do you know anything about that, Maria Patricia?
I understand that it's a platform where you as a client can create an account and they will guide you step by step on how to submit electronically yourself your claims to your insurance.
Mm-hmm. Mm-hmm. Yeah. So those are all things that you need to keep in mind for that. And this is the part that gets us into headaches. So once we have find out that a claim has been rejected, or if the client gets in their mail a statement saying that the claim cannot be processed or rejected, what are the things that people can do?
Well, one of the most common reasons that there are denial is because the information or either is incorrect or incomplete. What kind of information? For example, the provider's NPI number, like that is like an identification number for the provider, or the service code is incorrect or is not covered by the insurance, or maybe, as we were talking about, the payer ID is the incorrect one. How to handle it? First, call the insurance and understand what went wrong. Why is the reason for the denial? And then you correct it. If it's something that is incorrect or incomplete, you fix it, and then you resubmit them. We said here, don't give up, because we understand that this step is a little bit frustrating and it's time consuming. So if you're doing it yourself, just correct the errors and resubmit them. They always go through. If the service is covered, it always goes through. Claudia, I believe you are in mute.
Yes, thank you. I was going to say that if we are the ones who are submitting your claim, if you find out what the issue is, you can let us know and we can resubmit on your behalf. And hopefully, things will get reimbursed as long as the diagnosis is a reimbursable diagnosis, right? Just kind of make sure that therapy is considered medical bill. So there has to be a diagnosis for you to be able to use your insurance benefits. So all of that, we can always try to also correct whatever information they say that is wrong. And we can try to resubmit it electronically. If at least one time again doesn't go through, we will kick the ball again to your court and give you a super bill for you to submit directly to your insurance. Well, I hope that that this was very helpful, Maria Patricia. I think that you covered a lot of important and crucial key questions and concepts for people to have an easier time understanding their out-of-network benefits. Of course, this part got in Spanish. I apologize for the copy of this slide. But any questions, you can contact us at Connect at Center for Effective Therapy. If you are interested in exploring, seeking our services, you can send us an email to intakes@centerforeffectivetherapy.com. And now you know who will be at the other side of that email, trying to kind of get you set up. And the QR code that is there has, if you want to take a picture, has information about our clinical team. We would be thrilled to kind of be able to work with you. So thank you, everyone, and let us know if you have any questions. And thank you for being here. Thank you, Maria Patricia.
Thank you. Bye.
Bye.